Hi everyone, welcome. Sorry for the delay. We've had some technical difficulties and now we are live. So, welcome to Foundry Virtual Speak Up 5-week webinar series where we will dive into what your rights are as a young person in BC. Each week we will be answering important questions that may impact you along with some of BC's most effective advocates. And today we're talking about how do I tell my doctor what I need? And we're very lucky to have Lux Welsh from TransCare BC, and they're a community support worker as well. And Lux, I will send your video now.
Hey. Oh, okay. That's doing something wrong. Can you hear me okay?
I can hear you fine. Oh, and I forgot to introduce myself. My name is Anne. I will be moderating this event, and I'm a peer support worker from Foundry Virtual.
Hi, everybody. My name is Lux. I use they, them pronouns. I'm also a peer support worker with an organization called TransCare BC. So we're a subsidiary of the Provincial Health Services Authority here in British Columbia. We offer support and medical navigation services to two-spirit, trans, non-binary, otherwise gender diverse people in the province as they sort of like strive towards accomplishing some goals around physical or social transition. So we can help people get attached to doctors for things like hormones and surgery. We can also help people get attached to like counselors or community groups. I had like a weird situation with my audio. I think I like hacked the system. I have my audio coming from a laptop and my video coming from this computer. Can you hear me better?
Yeah, I can hear you way better.
Okay, great.
Yeah. And oh, and just a note that Lux is using another peer supporter's, another person's account because of the technical difficulty. So you might see that their name is different.
Right. My name is not Raymond Johnson Brown, although it is a beautiful name.
Yeah. All right. Thank you so much, Lux, for introducing yourself. So what's going to happen here is we're just going to have like a Q&A style, and I'll start with maybe a question that is, Lux, do you have any ideas or ways to navigate difficult conversations with your health professional?
Yeah, so I think to begin with, I just wanted to say, over the last little while, my friend Anne and my other colleagues at Foundry collected some questions from, I'm assuming, probably some of you viewers and some other people in the province around self-advocacy and talking to healthcare professionals. And I just wanted to say I was really struck by the vulnerability and the honesty in some of these questions. I personally, not even as a professional, but just as another person in community, I'm really, really sorry that these are some things that lots of you have struggled with and that you're reaching out for support with. It shouldn't have to be this way. We shouldn't have to worry about these things, but the medical system being such that it is, I am so glad that people reached out. I think that maybe as a way of answering that question, or at least to start, I think reaching out for support and using our networks and also recognizing that we deserve support and that we should get that. It's a really good place to start. I'm a little bit of a chatty Cathy. Can you remind me what the question was?
Yeah, thank you so much for prefacing that too, Lex. The question was, do you have any ideas of ways to navigate difficult conversations with your health professional?
Yeah, so I think it's a tough one, right? Having to get vulnerable with somebody who for a lot of reasons, I think lots of us have complicated relationships to begin with. Mm-hmm. I would say first and foremost, and it's maybe not super helpful in certain cases, but in others it is. My primary advice is to remember that like doctors and other people that we encounter within caring professions are also people, right? With their own biases, their own limitations, their own skills. So yeah, I would say that it's important to remember that, like, you know, in preparing to negotiate for our healthcare needs or for our mental health needs with a provider, we are kind of like bumping up against like the system, the structure, but we're also in negotiation with another person, right? So to accept and to recognize that there may be some limitations as to the kind of care that each individual provider can provide, but also to remember that, you know, it's not like, or at least it shouldn't be like fighting against like a machine or a robot, right? Like there's different things that different people can provide at different times. So it is unfortunate that often those of us who are coming to caring professions with what are currently considered to be like unique needs, like people looking for gender affirming care, for example, or anybody who's like generally marginalized by healthcare communities, people with chronic pain, people with substance use. It is unfortunate that we do have to go this extra step of doing the self-advocacy, but also it's important to remember that like the same system that's like creating these situations of inequity where we're like trying to find care, we're trying to find support, we're having a tough time getting it. Those are the same systems that produce doctors, right? And people that are within these roles. So just like we can be frustrated with maybe like a relatively small amount of information that providers get about supporting people like us, we can also recognize that that is also the material reality for a doctor or for a counselor, right? Like they only know what they know. They only have access to the training and support that was provided to them. Some of them are more proactive than others in terms of like going out and continuing their education. But sometimes, and I know that this is the case for people with chronic pain or substance use, sometimes we are in a position of having to be sort of like experts and advocates in terms of like getting access to the kind of care that we need. So just like you as individuals can like go out and like become educated and like learn more about the services and supports that are available to you, the same is true for doctors, right? So if you have the sense that you're going to be coming to a provider with maybe a unique need, and again, it is frustrating that we have to do this as patients or clients, but sometimes it's good to also bring along, you know, some information or some ideas of places where the doctor could reach out to for support, you know, like, especially if you're going to be talking to a provider about something that you have the feeling that they might not have done a lot of work with in the past. Sometimes it's useful to say like, okay, this is where I was getting my information, and like, what do you think about that? Or like, here's some information and support that I found for doctors who are looking to, you know, like beef up their education or get a little bit of mentorship and guidance. Like, here's some places that you could maybe go if you wanted to learn more about supporting people with needs like mine. Yeah, I don't know. It's like, it sucks that like we're here having to like fight and advocate, but where possible, if possible, sometimes it can be effective to recognize that, kind of like I said earlier, like often doctors and providers are coming from the same place of not having received that education, not having received that support. So if you have a good connection, if they're otherwise supportive, but they just don't know, or they just don't know in the right way, sometimes it can be useful to approach it collaboratively and to say, like, I recognize that maybe currently you don't have all of this information, but can we work together to get that? Or can we work together to maybe get me connected with somebody who does? Sorry.
Yeah, no, I think that's so important, the collaborative process of kind of advocating to your medical professional and trying to really advocate for ourselves. So I guess like some of the possible challenges youth may face, you know, when seeking support from a medical professional, do you have any kind of, do you know of any possible challenges they may face? Like, for example, when they're advocating for themselves or seeking support for themselves for like chronic pain and TransCare specifically, and some youth have asked about eating disorders.
Yeah, well, when I was thinking about this question, it kind of brought to mind a story. So within my role, like primarily I offer peer support and kind of health navigation assistance to youth. I work in partnership with a Foundry site, not just with Foundry, but it's a big part of where I connect with people. And in my home community, there's also a university where you can go to learn how to be a nurse. So even though I'm not like an educator, I'm definitely not in a position where I'm teaching doctors or nurses or anything even close to that. One of my colleagues is a professor in the School of Nursing at this university. And over the past couple of years, we kind of have this ongoing tradition where on one of the last days of classes for her fourth year nursing students, she'll bring me in to like compare or to go over some case notes from like trans and gender diverse clients who experience multiple barriers, just so that nurses can kind of see like what are the impacts of trying to access care as a gender diverse person, where can this show up, what other barriers can this bring up for them? And the reason I bring it up is because this is one class that happens for less than an hour once in the entire 4 years that these students study to be nurses, right? And it's not to say that at no other point in their education do they ever talk about trans people, gender diverse people, but this is the only time in their education that's dedicated to discussing the needs of that specific population. Which, you know, in the grand scheme of things, like less than an hour over the course of 4 years is really not all that much. But what really sticks out to me about that and what feels maybe a little stark is that I've spoken to other professors in the department, and I've also spoken to students from other schools of nursing who are so impressed by that, right? Like they're so kind of astounded positively that this school in question creates that time and space for their students to discuss the needs of trans people. So, you know, like even though to you or I, it might seem like such a small amount of time in the grand scheme of things, from another perspective, from somebody else's perspective, that is like a really big step forward in terms of like opening up healthcare, in terms of kind of progressing that conversation. So I think first and foremost with all of those things that you mentioned, like talking about gender affirming care, talking about chronic pain, talking about eating disorders, I think it's often the case that like the people that we're kind of taught and socialized to reach out to for support, they just don't actually know. They don't have that training. They don't have that special, like, you know, specialty or whatever it is. And I think that's something that I'm not going to say like uniquely impacts young people today, but it shows up in such a different way for young people because we, in like a super unprecedented way, are so much more informed and connected, and it's so much easier for us to form intentional supportive community with each other. So like how many people do you know that struggle with like, you know, like a connective tissue disorder, for example, who get like huge amounts of support and advocacy from friends online, and that's where they get most of their information, most of their guidance. So we're kind of at this like what feels like kind of an annoying like cultural turning point where we as patients are getting so much more informed and so much more supported, and yeah, like so much better able to advocate for our needs. But like the education piece on the side of the providers hasn't caught up to that yet. So we're kind of becoming experts alongside of, if not faster than the people that we need to reach out to for support. So it is this like really kind of annoying thing where it's like you as maybe a trans person or maybe somebody who is experiencing disordered eating, you could be the expert in your own care needs. but you can't administer them, right? You need that
Mm-hmm.
doctor to help. You need them to sign off or to prescribe or to refer. So I think in like a very general sense, that's like a pretty unique frustration facing youth of today, whatever you want to call it, is, like that like frustration. Like I think before, like I know definitely in my like my parents' generation, for example, I don't want to date myself, but way back in the day, I think that if, for example, a trans person in small town rural Canada in like the 60s or 70s, if they talked to their doctor about it, their doctor would just say like, oh no, I don't really know that. Like there's not really treatment available for that. Sorry, like that would be kind of the beginning and end of that conversation.
Mm-hmm.
Whereas now we can come to these appointments with all of the information that we need, with kind of like an idea of the trajectory of our care. But if we can't find any people to help us along that path, that's where it gets really frustrating. And that's where so much of the frustration with current medical systems lies with so many people. So to go back to the question, I would say, like lack of specialized education for providers, lack of access to specialty providers. Like there's so much to it, right? Like the system, it's so, like, it's not to say that like every single trans person or every single person who experiences chronic pain will experience the same struggles across the board, right? Like I wish there was a little guidebook, like your doctor's going to say this, and this is what you say when your doctor says that. But because everybody's needs are so unique and so impacted by other aspects of our socialization, other aspects of our, like our physical ability or our indigeneity, like there's just so much that wraps up into it that it's like, I can definitely understand why there's been so much more of a push towards peer support and representing young people in like within caring professions, because it can get so overwhelming, right? Like you don't even know where to start. If your doctor doesn't know how to talk to you about hormones, like who the hell else do you talk to about it? So I think that is like overall like a really big barrier facing young people is like, we know so much more about what we need than we ever did before, but we need everybody else to catch up.
Yeah. Do you find that with doctors or with youth and young people having more access to information online and having maybe even more of a better idea of what they need, do you find that doctors are receptive of that?
Sometimes.
Sometimes.
Nice ones. And I think that comes back to like that piece about doctors being people, right? Like I think on one side of the coin, there's so many doctors that are compassionate and that are patient focused and that they uphold like the experience and the needs of their patients above, like protocol and process. But on the other side of that coin, there's also, unfortunately, just like in any other profession, there's doctors that are really motivated to protect their ego, or doctors that are really, like motivated to be really procedural and to stick to what they were taught, which is, like it's hard because it's not always bad, but it's not always great. I think that there definitely are some doctors who are kind of shifting their practice to incorporate more feedback, more patient experience. And I definitely, like, I don't know about you, but I think at least in certain parts of the world, in certain, like under certain umbrellas of care, I think that we are seeing ways in which like client feedback and client experience is actually informing how like the way the care is offered is structured, but it's never fast enough, right? Because like when a young person needs help and needs support, they don't need it in 3 months. They don't need it after their doctor can take an inclusivity class, right? They just need support. So it's like,
Yeah, they need support right there and then. There's no time for like them to wait for support if they're really in need in the moment.
Yeah.
Yeah. Yeah, so I guess like how would you describe what it's like accessing primary care as a trans person?
Well, I would say, I would like to say that it's getting better. At the very least, I would like to say that kind of like the pathways and the process and what it looks like, it's getting more solidified. Um, like more and more people are getting a sense of like, okay, you want to start hormones, what are the steps it would take for you to be able to do that? That kind of information, it is getting more common and it's more commonly disseminated.
Mm-hmm.
I would say one of the things that's really challenging about it is, and we see it in other aspects of care too, like we see it with substance use support, we see it with like being able to provide like adequate care to Indigenous people. And it's that it's so different from place to place, right? It's so regionally dependent, and it depends on like who is actually on the ground, who the actual providers are, and what their philosophy is, what their personality is like. But in the example of gender affirming care, for example, it just like straight up actually is different. So like in BC, we adhere to like a certain standards of care and a certain set of guidelines. And then what it looks like to start hormones in Alberta is super, super different. And then what it looks like to start hormones in like Idaho, for example, is even more different. But like even like Victoria versus Vancouver versus Kamloops, like those trajectories are going to be so, there's different people available that can provide different services. So I would say overall, something that I find often with my clients is this feeling of, unless you get really lucky and you get paired with a really awesome doctor, there is a lot of advocacy that's required. It is really common for me to see people who are trying to access gender affirming care being made to kind of like spider web out where they're receiving support from. So like, I'll see this person for the assessment and I'll see this person to prescribe my hormones, but I'll get my blood tested by this person, like, I think overall that is like really common, unfortunately, although it's getting less that way. And I think that is, it's kind of like a problem that's not a problem. Or like a problem that maybe doesn't seem like a problem. Because like going back to what I was saying earlier, it's so amazing. I would say now more so than any other time in history is an incredible time to be accessing gender affirming care, because we have a wealth of information available to us, right? Like if you're like, I want to start hormones, you can go online and find probably somebody who looks pretty similar to you, who has also started hormones, and you can kind of like look at what their journey was like. I think that in general, like trans communities, gender diverse communities tend to be very giving and very supportive in that sense. I think as a response to how kind of like gatekeeping and strange it can be to access healthcare as a trans person. But I think one of the unfortunate like risks of that, or like one of the things that can be frustrating for some people, is with gender affirming care, it's not like if you break your leg, right? Like if you break your femur, you can go to any hospital and they're more or less going to do the same thing, right? Like they're probably going to make it so your leg stops bleeding and it's not bleeding anymore. So like no matter where you are, like you would get a different surgeon, or I don't know, do you get a surgeon if you have a broken leg? You know what I mean? But like you have an idea of what that's going to look like. But I do see some people who, because they have this sense that in order to access healthcare as a trans person, it really needs to be like this huge project of self-advocacy and research, and often it is that way. One of the things that I see is that people will get information that is accurate here, but not accurate here. So they're kind of going along this process in adherence to a certain set of guidelines or certain standards of care. And they spend all of this time and sometimes like money and effort kind of like following a certain process. And then it turns out, unfortunately, that that's not actually the way that it works in their home community or in their region. So there can be some what feels like kind of like lost time or wasted effort, which is really unfortunate. Yeah, it's like, I don't know, it's one of those crappy things where it's like, it's really awesome that we can get information support from our community members, but it kind of sucks that we have to be so discerning and selective of where that information comes from, or we kind of have to take it that extra step of being like, okay, that's how it worked for them, but how is it actually going to work for me?
Right. Yeah.
So that's another piece, I would say, like, in terms of what it's like accessing gender affirming care. Definitely my recommendation would be to get support and to get guidance from somebody who knows kind of like the lay of the land in your specific region, whether it's like a friend or friend of a friend, coworker, or whether it's an organization like TransCare BC, where our entire mandate is to help people navigate the healthcare system and get attached to providers close to home or as close as possible. Because yeah, it is so like confusing, and you can get pinballed around, and you have to do this to get hormones, but you have to do this to get surgery, and I could go on and on and on about the process itself and how obtuse it can feel, even though I would say it's more effective now than it has been even in my lifetime. But yeah, you know, accessing healthcare as a trans person, some of it's really cool and exciting and fun, and some of it is like not that. And it's unfortunate that it can be so dictated by where you are in the world, who you have access to, what finances you have access to, what other supports you have access to. But what's good now, at least in BC, is at the very least, there's people that are available to help. And, you know, that's what their mandate is. That's what their whole job is, to make sure that you get access to and you receive the kind of care that you need and deserve.
That's so great. And so I guess some of the other questions that we received are, and I think this is quite common, is that the person says, I am concerned about my mental health, but I worry it is not bad enough to warrant help. What should I do, and what services exist?
Don't wait. Seriously, don't wait. I think it's so easy, and like I have it in myself too, to play that game of comparison. I think we're all our own worst critics, and especially people who are really empathic or who are informed about mental health supports, or who are just kind of used to being that kind of like really supportive friend for those around us. I think it's really easy for us to fall into this game of comparison of saying like, oh, well, maybe I could get some support, but there's all of these hypothetical people out there that need it more or who deserve it more. And I think it's like, you know, like I could go off on this like sort of like inspirational tangent about how it's not true and we need to believe ourselves and honor ourselves. And I think we've all heard those kinds of messages before. But I also think from a practical standpoint, it's just actually not true, right? Like going back to the example of the broken leg, you know, nobody says like, oh, my leg is only a little bit broken. Like, I don't, like there's people out there whose legs are way more broken than mine. Like they need that way more than me. In that case, you know, if you have a broken leg, even if it's like you can still walk on it, it might be super painful, it might be really uncomfortable, but you could force yourself to. In doing so, you're exacerbating the situation, right? You're making it worse, or at the very least, you're not contributing to improving it. So from the perspective of a provider, who I think is kind of like the enemy in this case, or like the person who would turn us away, the person who would say that our needs aren't severe enough, you know, from the perspective of a provider, they would rather meet with you early into that process where you're starting to have those questions, you're starting to identify some needs that you might have, so that there can be some appropriate intervention before it gets to that crisis state, right? Like if you're one of those people that's like, like I don't want to take services away from people, like I don't want to cause a fuss, I don't want to make people worry. Like, how much are they going to worry if you get no mental health support and then it turns into a huge crisis? And then we're looking at involving crisis supports or accessing multiple teams, right? Like, I would just say, like, you know, like if you are wondering if you might need some mental health support, if you're curious about what that could look like, if you don't know what sort of support you would qualify for, just ask somebody, right? Like, you know, like we could sit here all day long and be like, like, I wonder if I should see a counselor. I wonder if I should see a psychiatrist. But at least for me, there was a long period in my life where I didn't actually know why people would see a counselor or what kind of support they could get for mental health. And it wasn't, and I think this is the case often for people, it wasn't until I got to that really crisis boiling point that I felt deserving of accessing that support. And at that point, it wasn't just that I was struggling with this, it was because I was struggling with that now I was struggling with this, and I lost my job and I got kicked out of school. And there's all of these other things, you know, where I was kind of like, oh crap, like, wish I would have talked to a counselor. And then also too, you know, like if you go to a doctor and you're like, hey, I'm kind of concerned about my mental health, if you're wondering if you need support, you probably do deserve some support. But let's say on the off chance you are just like totally out to lunch and you have no idea of your needs compared to somebody else's needs, like somebody would just tell you that, right? Like they would just say like, okay, like based on the acuity that you're presenting with, you probably don't need to go to a crisis center, but you could maybe check out a supportive peer group, or, you know, like maybe there's some positive community connections we can make for you. And, you know, like it doesn't always have to be this like, I need emergency support for you to like want and deserve some support, right? Like everybody deserves to be happy. Everybody deserves to have like a positive relationship with their own mental health. It's not only for people whose lives are getting super screwed over.
No, for sure. I think it's definitely crucial for us to understand that everyone deserves the help that they can get, and that they, you know, there is no best time to access support. It's like all the time is the best time. Yeah, thank you. I guess there are a couple other questions. So I guess on the same vein of what we were just talking about, when we do go and ask for mental health support and maybe chronic pain support or disordered eating, how would someone advocate for themselves with their medical professional?
Yeah, because, you know, like it's easy for me to say like, go and ask for support, right? But we also hear that sometimes doctors don't offer it, or sometimes doctors in their mind decide what sort of support they think that we qualify for, that they think that we need. So we can like be super prepared, we can do our research, but we don't always get the kind of answers that we want or that we think would be most effective from our doctors. I think that there's a couple of ways that you can approach that situation. Kind of like I said earlier, something that's really common, at least for my clients, for people that are seeking gender affirming care, for example, really, really common for them to talk to their doctor about it. And their doctor says like, oh, like, I don't know anything about that. I don't think that I'm the best person to support you. And like, in my mind, I'm like, okay, like you might not have some specialized training in gender affirming care or supporting disordered eating, but you are a doctor who probably is a pretty intelligent person who made it through 8 years of school and has the capacity to learn and like, you know, get really good and really effective at supporting people. So I always encourage people to start with educational supports. Like if you have a doctor already, that is so hard to come by, at least where I am in British Columbia. So if you already have a family doctor, keeping that connection, even if it's just somebody that can monitor your medication or send referrals or send blood recs, it's so hard to get a doctor to begin with. So starting off with some educational supports, like for example, with TransCare BC, there's actually a lot of ways that doctors could call and get some mentorship. They're like, oh, my client wants to start hormones, but I don't know what that looks like. Like, can you teach me? There's a lot of avenues for doctors to continue their education. I'm pretty sure that they like have to, right? Like, I'm pretty sure that there's like a certain amount of educational, like, whatever, I'm not going to talk about it. Doctors have to keep learning. So
Yeah.
that's a really good place to start, is like, okay, like if you don't think that you're the appropriate provider, is there some way that we could get you that information and support so that you can continue to be my provider? Really good place to start. You might find that doctors would say like, I don't have the time, it's a little out of scope. In which case, like asking for a referral to a specialist and being a little kind of persistent about it, I think is another good option. Like being like, okay, well, if you can't support me with that, either I researched ahead of time and here's some ideas of people you could refer me to, or do you know somebody in your network who does have that information who could support me with that? I find that with referrals, because that's kind of more like the busy desk work stuff in a doctor's office, sometimes that is the stuff that can get like pushed to the side of the desk or it doesn't get prioritized. So if you ask your doctor for a referral to a specialist and it feels like it's taking a long time, or it feels like you haven't heard back from them, there's definitely nothing wrong with calling your office or the office that you were referred to and just inquiring as to the status of your referral. You know, like if it's your doctor's office and they haven't sent it yet, that's going to encourage them to send it a little bit faster so you stop calling and bugging them. If you call the specialist and they haven't yet received the referral, that's a really good place for you to start building the process again, getting back in contact with the original doctor, being like, hey, they haven't received it, can you send it again? I would say, especially in smaller, more remote communities where there aren't a whole lot of options, sometimes, unfortunately, that is where we get more into like the capital A, like advocacy. You know, like just like doctors, unfortunately, often don't get like specialized education to support certain kinds of medical needs. The same system that produces that kind of educational inequity also, as we all know, produces all sorts of other kinds of inequity along the lines of race and indigeneity and ability. So it is unfortunate that if you are a person from a marginalized class that is impacted by things like racism and ableism, if you are part of a population of people that often is considered to be or made out to be kind of like aggressive or argumentative or whatever, any of the things that doctors can say as an excuse for why they don't want to support you, if you're able to, it can be so good to have an advocate, somebody who maybe doesn't even have to say anything, but who can just be present in the room with you or during the visit, like a calm, sort of like more of like a reflective support, somebody who can just kind of watch and document and say like, okay, like your doctor said that you were really aggressive or you were drug seeking or whatever, but from my perspective, that's not how it went. You know, sometimes it's a little bit, it can be effective to have another perspective, another set of eyes. You know, like if you are fortunate to live somewhere with a Foundry, like that could be something that would be really effective to reach out to a peer support worker for, an outreach worker. But even like moms and grandmas, although I don't know, sometimes I find that moms are the ones who really escalate some of the tension.
Yeah, I find that too.
But, you know, like if you know that, and it's unfortunate and I don't like saying it, but like if you know that it would be easy for your doctor to kind of write off your needs or to write off you as a person, and you still need that care and support, sometimes having somebody come along with you who can just be an extra set of eyes, maybe an extra voice, sometimes that can be really effective. Yeah, I don't know, I just like...
Yeah, I've definitely found in my experience having someone come with me to my appointments has been very, very effective. and a positive kind of influence on the way that the appointment goes.
Totally. Like, especially if you're maybe gearing up to have a little bit of a disagreement with a provider. Like, I know for me, if I'm picturing myself going in and like kind of getting a little stern with a doctor, in my mind, that's a pretty nerve-wracking experience. I think my anxiety would go up. I think I would have a lot of difficulty in that situation. So sometimes it can be effective to have somebody there just be like, wait, like, do you remember you wanted to say this specifically? Or like, these were some questions that you had. Because like for me, my anxiety brain goes a million miles an hour and I just can't say anything. I can't advocate for myself in that sense. So like having somebody to kind of like hold it down can also be super effective as well. Somebody who can write notes down if you have difficulty with recall, for example, or details. Yeah.
Mm-hmm. Yeah, totally. I think we have time for maybe 2 more questions. So let's see here. So I think one of the other questions that we received was, I am scared my doctor won't help me because I can still function in so much of my life, but on the inside I am exhausted from debilitating anxiety and fear. And so maybe just speaking to that a little bit, and I know we kind of talked about it in a previous question, but maybe just like specifically to that.
Totally. So this is just my perspective. This was a really helpful way for me to conceptualize anxiety. For me, I try to think about anxiety as it's about potential, right? It's about what could happen. And I think that for people is like a very stressful notion, especially when it feels difficult for us to anticipate what might be able to happen or whatever. I think first and foremost, at least for me, when my anxiety brain starts thinking about what could happen in this situation, the voice that mentions the negative outcomes is much, much louder than the voice that mentions the positive outcomes. So I'm always fixating on like what could go wrong, what could go wrong, what could go wrong versus like what could go right. But if we think about anxiety like that, like kind of like nervousness around an unexpected outcome, nervousness around change or something that we can't anticipate, something that's good to know in this case, like if you're really, really struggling with something and it's already taking a toll on your day-to-day, but that's kind of now like your regular, your resting state, which is unfortunate. But if that's kind of where you're maintaining and that's like your flat line, you're just always dealing with anxiety and depression, that in and of itself can unfortunately become sort of like normal, right? Like that can be consistent, that can be comfortable, not like, oh, I love this and I'm so comfortable, but you know, consistent, reliable, predictable. So in this case, you know, like if you kind of already have this like baseline, this is what I'm dealing with, and you go and talk to a doctor, if they say like, no, I don't think that you need support for that, no, I don't think that you qualify for treatment, you know, in my mind, at least, like the worst potential outcome of that is that things just kind of stay the same, right? Like, it's not like the doctor is going to like punch you in the face for asking, or, you know, like it's not like something, hopefully at least, it's not like something substantially super negative will come out of that exchange. You know, like it might like suck to hear that your doctor doesn't believe you or doesn't think that you qualify for treatment, but at least then you know, right? It takes that question of potential out of the question. So you don't have to stress about what would happen if I talked to my doctor about this, what would happen if they didn't refer me on for support, right? Because it already happened. And then it's like, okay, well, that option's out the door. That doctor kind of sucks. Like, who else can I reach out to for support? What else can I do here? You know, like if the worst thing that can happen is that things are just going to kind of stay the same, to me, that's worth kind of like the nervousness and anxiety of reaching out and asking. It's not the same for everybody, but that would also be another situation where I think maybe having an advocate or somebody who can speak to your experience come along with would also be an asset.
Definitely. So for the last question, I was wondering if you'd be able to answer how can someone communicate their needs to their doctor, such as like getting a referral for trans-specific care or applying for disability assistance or other types of assistance that there are out there?
Totally. Well, I know for me, it can be super helpful to do a little bit of pre-planning for those kinds of conversations, especially if you're nervous about it. And it can happen even at the point of making the appointment with the doctor, right? So you call, you schedule the appointment, and you say, oh, it's because I want to talk about PWD. It's because I want to talk about hormones. So like that conversation is already happening within this container. If there is a certain outcome that you're really wanting, it can be super helpful just to write that down and to practice, like, what would it be like to say to this doctor, I want to start hormones? What would it be like to express this to your doctor? And then also too, I would say, especially if your doctor does determine that they're not the one to provide that kind of care, it's always fair to ask, okay, if you can't prescribe hormones, how else can you support me? Like, can I still access you as a general patient? You know, if you can't care for me as I experience disordered eating, can you, though, continue to support me in the ways that you are? You know, like when, I don't know, I think I get it from my mom, who's like a bargainer, where I'm like, when I hear no from a doctor, I always want to know, first of all, why. I'm like, can you explain to me why you can't offer that support? Sometimes there's a good reason. Sometimes we're less satisfied with the reason. Right. And then also to ask, what other kind of support then can you offer? I think it can be really easy. Like when we hear a doctor be like, oh, no, sorry, that's out of scope. It can be really easy for that kind of like self-defeating tendency to kick in and be like, oh, crap, like, I guess I just have the worst problem in the world and nobody can help me, or I guess there's nothing available for me, and just kind of like shut down or to accept that first answer. But I always, if you can, I really encourage people to ask then, okay, if you can't support me with this, what can you support me with? Like, yeah, do I need a referral? Do I need to get blood testing done? Do I need to look at medication? Whatever it is, because then, well, A, hopefully your doctor will help you, but also too, then it gives you something to kind of return to, right? Like, okay, I know that you as a doctor don't prescribe hormones, but that's something that I want. So how can you help me work towards that? Because yeah, I think we often see these people that feel like they're just kind of like shuffled off to the side and like nobody's following their case. And then that's when we get into those situations of people coming, I don't want to say too late, but coming at a point where everything is escalated well beyond the point that it should have, right? They should have been offered care. They should have been able to access that support way earlier in their process. You know, it sucks. I would say, remember that you're not alone. Like, there's somebody out there who's had that same kind of conversation with their doctor. There's somebody out there whose story can offer some growth and learning for you. So don't be scared to ask for help from your doctor, but also from your community, from your family, from places like Foundry. Yeah, don't be scared to reach out. Like, what it really comes down to for me is like, what do you as an individual need to be able to lead the type of life that you want? And not every doctor is able to offer all of those things to us, but they can be an important part in the step towards getting access to that support.
Yeah, thank you so much, Lux. What really stood out to me in that last part was the fact that you said, you know, when your doctor says no, ask them why. And I would have never really thought of that. And I think that's a great tip to keep in mind.
And I do think it's like, even though I think I'm like a little bratty or a little punky, like I wouldn't say like get up in their face and be like, why can't you help me? Like, we don't want to like move into a scenario where we're like antagonizing or like escalating situations with our doctors. But I do think it's totally fair game to be like, oh, interesting. Like, I would have assumed that a doctor could help me with that. Like, how come? You know, like approaching things from a place of curiosity, and then also maintaining like, I will get support for this. And that is my expectation. That's the outcome we're working towards. You don't have to be the one to give it to me, but you are helping me.
Right. Thank you so much, Lex, for your time. And thank you everyone for coming to watch our Q&A. And next week we have What Does the Mental Health Act Mean for Me on August 10th. So that would be a Monday at the same time from 4 to 5 p.m. And yeah, so thank you again, Lex, for everything. And we will see you around.
See you later.